I'm Fatemeh Youssefi. I'm oncology certified nurse. Over 3 decades of nursing, but specifically with about 24 years in a oncology world. I have been involved at the beginning of my career in oncology with the clinical trial that came about for the full FOX regimen, which that's oxaliplatin, leucovorin, and fluorouracil that took with a comparison with the FOLFIRI, which that was irinotecan. So we're going to talk about the side effects and some of the complications that what oncology nurses as a registered nurse need to know, and how can we do the symptom management and have open communications with our patients and our advanced practitioners and our providers to be kind of bridge those informations from patients to them, and how we can refer them to the accurate resources. So we cannot talk about any of our cancers without going through the body image and the self-image that's involved, especially when we're talking about the colorectal cancer. Again, populations on the rise are young adult. They call it young adult in a comparison of older with the GI. Then these are the adult that actually are below the age of 50. And steadily, that statistic is on rise. There is a lot of research and literature review that point to this population. Again, because of the being such a novice and happening increase in the number in the recent years, there is not much data to go back to see if this is a germline per the oncologists. When you look at the scholars, so it's not uncommon again for this population to present to the doctors, to the providers at the advanced stages of the disease. Could be that they had a rectal bleeding, which that could be like a stages in 3 and 4 at the time that they go to the physicians, to the providers, because not all of our primary care providers are aware of this new on rise steady rate, and it may take some few months to even receive diagnosis. There is a lot of data, again, in the literature that talks about educating the primary care providers with this population. And in general, with any time that the patient's diagnosed with rectal cancers, there is always a talk about having a colostomy, diverting that GI pathway to kind of get a rest at the stool passage, so they can clean, they can maintain the area kind of free of the passage of the stool. And we know that there are body image, self-image associated with having a colostomy. When I started in a oncology, in a nursing world, it was so much more focus of the topic. Now there are so many devices and gears that's available in the market that the one can use for the as a colostomy bag and the presentations. We know there are a lot of healthcare professionals, there are different careers, individuals that have colostomy and they go about every day, but help the patients to find a support group and to be able to talk about the self-images that's involved. Just a little bit about the anatomy of the colostomy and the passage of the stool. So we know if the colostomy happening at the descending portion of the colon, then that's the left side of the abdomen. Usually the stool is firm. If it's an ascending portion of the colon, usually this patient may have ileostomy because of the stool be very liquidy. So it's important to know and to educate your patients on a transverse side of the colostomy. Usually that's across the top of the abdomen. The stool may be a little bit soft as well as a liquid. So educate your patients, make sure that they do have at the time of the surgical intervention, most of the academic setting, most of the hospital, they have wound and colostomy nurses that can reach out to the patients. And beyond just talking about the colostomy, the self-image, there are some regimen in the colorectal treatment that can cause diarrhea, or radiation to the pelvic area, so that this area can get very inflamed, very incontinent of the stool, and the patients may be homebound for that period of the time. So be proactive, educate your patient to see if they can organize their activities around that time if they're receiving the radiation. Involve the partners if that's what your patients wanted to have in the conversations, include in their conversation. And in general, that's the self-image and how they view these complications or side effects, to allow them to discuss their concern with you and with the oncology nurse. And again, not only educate your patients, educate each other, the colleagues, to find the resources, support group, connect them with social work, and then if they need further counseling, as oncology nurses, we are kind of the bridge of this and connect them to those resources. Make sure that they are taking the anti-diarrhea medicine the way that they should be. Don't shy away. It's not, these patients so often are on many medications and they may just want to skip it. This is not the one. As we probably, it's very much documented that drug aromatase can cause severe allergic effect. So this abdominal cramping, those are all interfere with the daily life. So again, educate your patients.